Hello everyone, welcome and thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you've called in via phone only, you can use *9 to raise your hand. In addition, please make sure to identify yourself by your full name and the organization or media outlet you're from prior to asking your questions. With that, I'll turn it over to County Manager Mike Callagy.
Thank you, Denise. Really appreciate that. I'm not sure I have any great nuggets of newsworthy information for you today, so hopefully you have some great questions. This is going to be a very short segment here. So, we're at 1697. That's plus 10 from Tuesday, and Tuesday was plus 16. So we're at 26 from Monday. We're glad to see those numbers coming down a little bit from positive testing, and we're certainly expanding testing right now. Sorry to say that we've had 9 more deaths since we last reported. We're at 75 right now. And if you look at that area of highest test positive, we have, the age of 30 to 49 is really the testing the highest. We do have the case by race and ethnicity now, positive cases by race and ethnicity. So I just want to thank Health for putting that together. That is a lot of work went into that, but that was what was requested. So they are most accommodating. As far as hospitalizations, we're at 60 right now as of today, and an even split between about 50% of ICU beds in use and 50% available. Ventilators surge still look terrific. If we go to, I just want to talk about this one here. We've had some inquiries about San Mateo with their cases that they've got 420 cases, positive cases, and someone extrapolated that out and said, well, based on a population of 103, that's like 403 cases per 100,000. And I just, want to caution against that type of analysis. It is just not factually true or proven that they have a higher rate than anyone else. We just simply don't know. And this was what Dr. Morrow warned against trying to do with this, because it does not pencil out in any way. We have no idea if there's more cases there because more people simply got tested there because the center was there. We just don't have any information on that. Or there could be thousands of people in any other city that are asymptomatic and are not getting tested. We have people that had more minor symptoms that didn't have transportation and just weathered it and didn't come up to San Mateo to get tested. We have no idea. So to say that you can look at this and say that San Mateo in any way is a hotbed of COVID-19 would just be factually incorrect. So I just want to put that out there that, and I know we've had some inquiries into that. So let's go on to this one. Thank you. For long-term care, we can see that 44 of the deaths, and that's what strikes me, more than half, and that's what we're talking about, and that's why we're in the congregate care facilities. We are approaching 23,000 completed tests, which is terrific. The positivity ratio is coming down to 7.5, and the average daily result is 1.62. We're glad to see that. On to the Verily testing. The good news to share here is that we have a lot more tests going out. So Monday and Tuesday, Verily had 500 folks each day. They sold out. They were doing 500 each day at the event center. Daly cities today and tomorrow, and they have been sold out very quickly for the 250 up there each day. And I suspect East Palo Alto will eventually be sold out. But they're still trying to work through this whole walk-up registration. That may be another couple of weeks so they really figure out how they can do that with the computer system that they have. So we're asking people to please pre-register, try to get in on those. We're trying to get testing expanded at these locations, and that may come over time. Verily has to request test kits, and they will be expanding that, Peter Wright, for each week that they get more tests. There's a higher demand, and we think that this will help us to be more informed as to the spread of the disease in this county. So please, if you're going to put out any message, please try to pre-register. And for those who don't, we've got the core agencies that they can go to hopefully help them register. The Bayfront shelter, let's talk about shelter. We've got the 3 guests at the event center, which has been kind of consistent, 6 guests in Burlingame. And then in the Bayfront station, we've got 90 with 7 rooms available. We're trying to get those folks in most of need of shelter with underlying medical conditions housed, and we're hoping to do that as soon as possible. Overall, total homeless housed in hotels are at now 174. And then just the other bright spot, if there is a bright spot through all of this, is that we continue to lead the state in the census numbers. We are at 69.7%. The state average is 60.2%, so we're well above that. And the national is somewhere, I think it's at 59%. So we are doing well there. We've got to do a final push through October and try to get well over 80% into the 90% if we can. That would be the goal at this point in time. That is really all I have. So if you have any questions, did I forget anything, Michelle? So if you have any questions, I'm happy to answer them now.
Great. Henrietta J. Burrows.
Yes, thank you so much. You mentioned the number of people who are being tested in the event center in Daly City. And I'm wondering, do you have any idea why these people are being tested? Are they testing because they have symptoms or because they just want to know where they stand?
Yeah, great question. I think it's really because people want to know. You know, there is the possibility of being asymptomatic and being positive. So I think people want to know. People want to have a baseline. People want to know that they're clear today. Again, you have to guard against you know, putting too much in that, because you could go out the next day and touch a door handle and be infected. So it's good to know if people are clear today, then they can take the precautions necessary to stay negative in keeping their distance and wearing their face coverings and washing their hands. But it certainly at least gives them a baseline to know that at least today they are do not have COVID-19, which gives them a sense of relief, and it gives them a sense of relief for a lot of these folks taking care of their parents or someone who may be more susceptible to this disease. So we're excited about that, and it gives us more data, more feedback as to how many people are positive in the community. So, and the good news is it's simple. I think a lot of people were scared off by that nasopharynx test. This is a simple self-administered test, and we have more people inclined to do that than they would have with the nasopharynx.
Okay, thank you.
You are welcome. Any other questions?
Raised hand. Emily Meebach.
Emily, you there?
Yeah, hi, Mike.
How you doing?
I'm doing all right. How are you?
Good.
Good. I just had one question. I was wondering, what is the county, if anything, doing to help prepare the rest homes for the potential second wave of infection?
Yeah, good question, Emily. So we have, and remind me, Peter, what the acronym is that you're using for the group that's going into the residential care.
Oh, medical task force.
So the medical task force was created in the county to really deal with the congregate care for residential facilities for our seniors. And they have, God, they went through what, 244 as of the other day of 300, they got 365 or maybe more out there, but they went through 244 of them already, where they'll go in, they'll do testing, they will mostly really help the staff get prepared, like to know how to don and doff PPE and how to deal with patients who might have COVID and how to keep them separated and more isolated in a residential care facility. So they're doing a great job of going in and training. They go in and assess the facility, and you know, we expect this to continue for at least the near future while we have them. We're using contact contract doctors and nurses to do this. While we have that, we might as well utilize them to the best of their ability, and they're fantastic at that. Oh, okay, and Michelle has a couple questions, so why don't we go to
They're
Michelle?
not my questions, they're from the Daily Journal, but they were texted to me, so I guess they didn't get through my spam filter. Much has been made of the recent death count increase. How recent is the data that accounts for the local number? Is it from this week or last week?
It's reported twice a week, so it's accumulation of a few days.
So I think it's probably, Peter, maybe I'm wrong, but maybe was it Tuesday was the last reported? Is it so?
Yeah, so it was a long wait.
So it's only twice a week that it's reported, because remember, we have to consolidate with the state and make sure that we all have the same numbers that we're looking at. And so it's reported twice a week. So it's probably a good bet that this was over a week period or so. Maybe since, maybe not quite a week, maybe since Friday or Thursday of last week.
With 2/3 of the county's deaths in the 80+ age range, is there an effort to ensure the safety of that age group?
Yes, we're trying to get as much messaging out to them, and clearly, even when this SIP is lifted, they should be very careful about what activities they engage in, going out into public, going into crowds. I would hope that stores would still, those who have it, maintain those opportunities for seniors to shop at different hours when it's less crowded. But they're going to have to, continue to watch until there's a vaccination for this. I mean, it clearly, and I gave you the numbers. 44 of the 75 are from congregate care facilities, and the vast majority of them, as you can see from the list that we have here, are over 80 years old. So those are the things that certainly concern us, and that's why we put this extra care into the congregate care facilities to make sure that we are addressing the highest needs in the community. Again, now, these are not our facilities. These are not something we're responsible for, but we certainly responded to.
Right. The county's population is older than other counties. At what point is the overall higher age of the county taken into consideration when it comes to death counts and meeting state standards?
That's a real good question. I mean, that's a good question. I don't think they've defined that or broken that out, but you bring up a good point. We're the fastest aging population in the state here in San Mateo County. I don't know if that puts us in a category where we have to be more careful as we open, or really try to work to continue to SIP those folks that are in that category.
Can you talk about the philosophy of moving away at times from the 6-county effort to keep orders aligned?
Well, I mean, I think we mostly are aligned, and I don't know how many folks saw the article in the Mercury, but I think certainly that was an unfair characterization of Dr. Morrow. I think that Dr. Morrow talks to his colleagues probably every day, and we have not aligned on everything that we've done in the past, but we were pretty much in alignment with San Francisco and Marin. So 3 out of the 6 we're moving on the same day and pretty much in the same manner. But you look back, and certainly we have not in certain areas have had different tweaks. Like Santa Clara didn't require the wearing of masks when other 5 counties did, and that was fine. That was their decision that they made, and they have to make those decisions. And so I don't think I don't read too much into that at all. I think that certainly Dr. Morrow is not off on his own doing these things. I think he's certainly doing it in an informed way, and to the extent that we're a little different than the other counties, or may move a little sooner or a little later. It's just things that he sees that really work for our county, and every county is a little bit different as we can all tell.
And then finally, how long can the county keep hotel rooms available for the homeless, and are there rooms being used for frontline workers right now?
I don't know about the frontline workers, but for the foreseeable future, we have to do something to make sure that we have those most vulnerable in the homeless population taken care of. And we don't want them to get sick in a congregate care living situation on the street where that spreads to multiple people and that spreads to more of the public. It makes sense for us to do it, though it is costly. I mean, it's, costing, I think 1.5 million a month to house all the homeless that we have in the hotels. So certainly we're putting in for reimbursement for that through FEMA. And we hope to continue to get reimbursed for that through the different funding coming down from the state and federal government.
We have another question from Henrietta.
Sure.
Yes, thank you. I could have followed up immediately after the first question I asked, but I needed to think a little bit about it. You had mentioned that the testing isn't with the swab up the nose, but it's self-administered. How is that self-administered? Could you explain that a little?
Well, having gone through it, Henrietta, I can tell you exactly how you do it. They hand you a swab that you literally utilize by just inserting in your nostril just a short distance, swirling it around. Then they hand you a tube, you drop it into the tube, you seal the tube and hand it back to them in a plastic bag. They never touch anything, you never touch them. It's all really well done, and it took literally 30 seconds to do. So it's very easy, very secure, and the turnaround, the time turnaround's pretty quick.
Thank you. Now, just a question in terms of the homeless being housed in hotels. How is that working out? I mean, are the homeless being very cooperative? One might think of dirty conditions, what may be stereotypes in terms of the homeless. What can be said about the conditions in the hotels, how they're being kept up?
I mean, I'm aware of a couple of incidents, but there's really been the exception rather than the rule. For the most part, I've heard nothing but very good things. Homeless being very respectful, and we have not had many reported problems at all. I mean, they're getting fed 3 times a day and taken care of, and I think they certainly value that. And I certainly don't want to give the message that all homeless are going to get a hotel, and that's exactly the message we don't want to put out there. It's really those with underlying medical conditions or those over 65 that are more susceptible to this disease. We have created more room in our shelter doing this by taking those most vulnerable out so that we can space those out in the shelter to 6 feet or so apart from each other, so we can make sure that we try to maintain some social distancing. We've added shelter beds at both the shelter in Redwood City and at We Hope in East Palo Alto. So there's various ways we've handled it, but unlike other places, I think that people going to San Francisco think they're going to get a hotel room. That's not the case. I think either here or San Francisco, but certainly not here. Because we are looking for those with underlying medical conditions that are most susceptible to this disease.
Thank you.
You're welcome. Anything else?
Yes. Sarah Wright.
Hi, this is Sarah Wright from the Half Moon Bay Review. I'm just wondering what, in terms of the metrics that the county has been assessing in terms of death rates over the past 14 days and case rates over the past 14 days, are those still the metrics that are guiding decisions for gradual reopening?
Well, the governor has just set new standards and we still can't meet them, but right now, but we probably have a better opportunity to meet them. But we meet them in the areas of things that are important to us, PPE and contact tracing, and the numbers are a little bit maybe off as to what the state would like to see us at right now. And I don't have the specific information because it's kind of confusing. It used to be, for us, no more than 1 out of 10,000 in 14 days. So it would have been 77 positive cases in 14 days. We certainly couldn't meet that. No deaths in 14 days. We certainly couldn't meet that. So it's loosened up a little bit. And I'd have to go back and look at it. I looked at it the other day and noted that we still would not be able to meet it to move to the full phase 2. And I think that Dr. Moore wants to, see how this phase 2 light goes over the next couple of weeks to see what kind of increases we may have or decreases we may have, and how are people adhering to the wearing of masks and social distancing and all the things that, wearing face coverings and social distancing, everything else that goes with this.
Great. I don't see any other raised hands, and there are no chat questions.
Great. Thank you all so much. We will see you back on Friday. Have a great rest of the week and stay safe.